يا الله، بسم الله الرحمن الرحيم. تسمعوني طلاب؟ السلام عليكم. السلام عليكم. صوتي تسمعوه؟ صوتي واضح؟ توكلنا على الله. السلام عليكم أبناء الطلبة، طلاب الصف الثالث ورحمة الله وبركاته. أهلا بكم محاضرة جديدة، محاضرتنا رقم 12. بداية قبل ما أبدأ بإلقاء المحاضرة أود أن أنبهكم. طبعا عددكم بعد ما مكتمل، أتمنى أن الحاضر يبلغ الغايب إذا ما الجماعة اللي بعدهم ما حاضرين لحد الآن، أنه إحنا بالأيام القادمة إن شاء الله، وخاصة في وقت المحاضرة العملية أو في وقت المختبر العملي، إذا كان على الزوم وإذا كان إن شاء الله نتوقع من الله أنه سبحانه وتعالى يجعلنا نحضر في المختبر، نمهد للامتحانات. وراح تكون امتحانات من نوعين، قد يكون امتحان إلكتروني يعني كتابة، وقد يكون امتحان قد يكون شفهي. وراح نعول على الشفهي، وشوية شلون نقول نعتمد على الشفهي، لأنه بمجال أوسع للسؤال وللجواب، وبمرونة أكثر. يعني ما نريد نحكي تفاصيلها، بس الامتحان الشفهي بمجال أوسع للأستاذ. هي شنو غاية الامتحان؟ غاية الامتحان أنه الأستاذ يكتشف ما عند الطالب من معلومات. فالامتحان الشفهي قد يكون صح هو متعب بالنسبة للأستاذ، وفعلا بجهد كلش كبير، لكن بمرونة أكثر له، وبمجال أوسع لطرح الأمور. يعني أنا الطالب هسه إذا أريد أمتحنه كويز لكل واحد بالشعبة، أمتحنه بسؤالين أو أكثر، 3 أسئلة. لكن بالشفهي أقدر هواية أسئلة، وأقدر أناقشه نقاش بحيث أقدر الجواب اللي ما عجبني أظل أنتظر من عنده جواب آخر. تلاحظون الفكرة شنو؟ فكرة الامتحان الشفهي أنه أني جاوبني هو، لو على ورقي راح أحط له خطأ وأحط له تصحيح للخطأ مالته، واعتبر احتمال 0. بينما بالامتحان الشفهي اكو عندي مجال انه انتظر من عنده جواب اخر، حتى مو اللي اقول له يعني هذا مو جواب صحيح، يعني حتى لو مجرد اسكت وانتظر من عنده يجاوبني جواب اخر، عنده فرصه اخرى للاجابه، وهكذا. يعني بصوره عامه الامتحان الشفهي بمجال اكثر، وان شاء الله راح نعتمد عليه بالامتحانات بالمختبر العملي، من اجل انه نعطي قيمه اضافيه للامتحانات. وراح يكون عندنا امتحان الفصلي، وراح يكون على شكل دفعات، همين ما راح يكون كلكم دفعه واحده، قد يكون نسويه على شكل دفعات، شعبه حتى نسيطر على العدد، ونسيطر على التصليح، ونسيطر على التحكم بالامتحان. توكلنا على الله. بسم الله الرحمن الرحيم. In the last talking we have talked about many things, and these things they are concentrated in 2 steps of bridge construction. The first step is the examination and designing and the planning of the restoration, especially if it is bridge. And we talked about the in the laboratory we talked about the examining of the patient, and we how we are going to design a bridge or design the treatment of the patient. And we talked about the second step is the preparation, and we have many lectures were discussed about the preparation of the abutments or teeth for different types of crowns. Now we are going to shift to the to another step of crown construction, which is considered as an important step of bridge construction or crown construction. Why? Let's listen to me. If you are expert in doing a nice preparation and then you take an impression for this nice preparation, but your impression is not good, the result will be a wrong and a failure work of the final restoration. So it is a copy of your nice work. You must put your careful skill to take a nice impression and successful impression for a nice and a successful preparation to have a nice and successful restoration to the patient. The impression, it is a clinical step. The dentist is going to do this impression. It is defined as a negative imprint or negative shape or negative likeliness of the tooth structure, the prepared tooth structure, and the other oral soft and hard tissues in the mouth. And again, we can take impression for the opposite arch. The impression, it is not concentrated to the or concerned to the side we work on. We must take impression for the other arch, the opposing arch, for the relation of the opposite teeth with the restoration and with the area we work on. How we can take an impression, or how can we get an impression? In general, the impression requires a material which is made from soft or semi-soft material. This material is going to be seated or put in a tray, which is going to hold the impression material. And when we put it in the patient mouth or insert it in the patient mouth, we wait until the material complete its complete reaction, chemical reaction, or any other type of reactions, and it's set, completely set. We can remove it from the patient mouth to have what we call it the impression. It is a negative shape of the oral tissues, the hard and soft tissues. After we take the impression, we are going to fill this impression with gypsum material or any type of materials, not gypsum, any type of material to produce the other positive likeliness, which we call it the working cast or model, working model or working cast, on which we are going to construct the restoration in the laboratory or in the clinic. So this is the impression in general, or definition of impression. The successful impression, if you want to take a successful impression, or what are the considerations which make it considered as a successful impression. First of all, when we take the impression, it must be an exact record for all the aspects of the prepared tooth, especially when we have a last tooth in the mouth, the distal abutment. The material must reach to that last or distal abutment and must record all the surfaces of this tooth, including the part of the unprepared teeth, or it's better to include all the arch in this impression. That means the adjacent structure of the abutments must be completely recorded, and sometimes we need all the arch to be recorded for articulation with the opposite arch. Look to the pictures. You can see that all the surfaces of the prepared tooth and teeth is recorded, and a nice recording of the adjacent teeth. The last tooth in the lower picture, you can see even the adjacent last tooth is completely recorded, and you can see the fine details of the required tooth or the abutment tooth is nicely recorded. Now, all the teeth in the arch, secondly, all the teeth in the arch and the adjacent tissues to the prepared tooth must be reproduced or printed or taken in the impression to permit accurate articulation of the casts of the opposite tooth or the opposite arch, and to allow proper contouring of the restoration with the adjacent teeth. Now, here we must record some of the adjacent teeth to the area we work on. Why? For two reasons. First of all, when we want to articulate the opposite arch with the area we want to work, it will be good or easy to articulate the opposite arch for studying the occlusion of the opposite teeth with the restoration. And the second purpose is to contour the contact area of the restoration, even it is a crown or a bridge, with the neighboring teeth, to create nice contouring of the distal and mesial surfaces, to produce nice contouring of the contact area, to produce good embrasure shaping of the area. If there is no any recording of the adjacent teeth, it will be difficult to do this nice and perfect contouring of the restoration. The third thing, the impression must be intact. There must be no any tearing or any damage in the shape of the impression, of the shape of the required tooth or teeth, and it must be free from air bubbles, especially in the delicate areas or important areas, which is the finishing line area or the margins of the area or the margin of our preparation. It must not be thin, which will tear during removal from the mouth, or it must not have any tear or air bubbles or damage in its area. These are things must be checked when you take your impression and bring it from the patient mouth. You clean it, you dry it, and you must inspect your impression for these three points which they are very important for a successful impression. If it is okay, you can go ahead and you pour your impression for producing the cast. Now, types of impressions. When we take an impression for a patient, we have two types. The first one, we call it the primary impression. It is taken from the beginning, sometimes from the first visit. The dentist will take this primary impression for certain purposes, and the material used for this impression is the Alginate impression material. It is very nice impression material. It is easy to be used and easy for the patient to bear the technique of impression. And we will have the three benefits or purposes from this primary impression. It is taken to the patient before we do anything for him during the phase of diagnosis or the phase of examination. After we examine the patient, and sometimes before we decide the type of bridge or decide the type of restoration, we can take a primary impression for the following purposes. One of them, which is the most important purpose, is to study the case. Sometimes we want to examine the patient from some views, or we want to examine the patient when he is occluding his mouth or biting his teeth, and we want to see the relation of the teeth during occlusion or during biting. When the patient closes his mouth, we cannot see all the surfaces. So when we take an impression, the primary impression, and we do the study casts, and we mount these casts on an articulator, and then we go ahead in the clinic or in the laboratory, and we study in details the case, especially during the patient occluding his teeth, and we can look to the surfaces of the teeth from the lingual sides, from the views, which is impossible to be seen in the patient's mouth. Again, one of the purposes of doing a primary impression and producing a study cast is to construct a special tray, especially when the mouth of the patient or the case of the patient require a special tray. Not all the patients require a special tray, but some of the cases require a special tray for constructing a crown and bridge, especially when the patient has missing all posterior teeth, and there will be a problem of difficulty in articulating the opposite teeth with each other. We can do a special tray and take the impression in the proper way to have a record for the edentulous area. Now, the third thing is the construction of temporary restoration. Before, sometimes, in some cases, and in some techniques, we can construct a temporary restoration before we prepare the natural teeth of the patient. So we can do this temporary restoration on the study cast, and we make it ready to be seated in the patient's mouth after finishing from a tooth preparation. The other type of impression is the final impression. This final impression is going to be taken after we prepare the teeth and finish from abutment preparation. We are going to produce a working or final model on which we are going to construct the restoration in the laboratory, and it is very important to have a successful final impression. As we said, if it is wrong impression, all the work or all the next steps will be wrong, and the final restoration will be not successful restoration. Now, if we want to take a final impression, we must prepare some things or many things before we take the impression. First of all, we must prepare a special tray if required, as we said. Not all the cases require special tray, but if it is required or if it is a case requires special tray, we must make it on the study model, and we prepare it before taking the final impression. Again, to have details, especially when we have the margin of the prepared teeth below the gingiva, and we want to bring the impression material below the gingiva, we need a special syringe to inject the soft part of the impression material below the gingiva. So we need a impression syringe or special syringe for injecting the impression material. Again, we must prepare the perfect and the suitable impression material which suit the condition we want to take impression for. Not all the impression materials may be suitable for certain case. So we must prepare the required or the suitable material for the patient. Again, before we take an impression, we must do isolation. We must dry the field. We must prevent any saliva or any humidity in the area, and we must retract or traction. We do traction for the gingiva to allow the impression material to go below the gingiva or around the finishing line to record the whole preparation in a perfect way. Again, the special tray is made on the study cast, as we said, and this is done before we take the impression. Now, we are going to talk complete dental material talking. We are going to talk in some details about the impression materials. The impression materials, in general, they are made from two types: non-elastic impression materials and elastic impression materials. Because we work on teeth, or all our work or all our crown and bridge and fixed restorations are done on dentulous cases. What do you mean by dentulous? Dentulous, that means the patient has teeth, even one or two teeth. This is, we call it dentulous case or dentulous case. Because of the anatomy of the tooth, which has an undercut way, it is impossible to take impression with non-elastic material. So all the materials which they are going to be used for cases of fixed restoration, crown and bridge, they must be elastic impression materials. That means what? That means the non-elastic impression materials will be used for dentulous cases when the patient has no teeth, like the designing of a complete denture for the patient. The non-elastic impression materials used for complete denture designing. Some of the cases designed for complete denture, they require elastic impression materials. due to the presence of undercut in the shape of the arch. The dentulous arch has an undercut in the sulcus area, or the shape of the mouth of the patient, in such a way, the arch of the patient, the ridge of the patient has an undercut which is difficult to be taken impression by non-elastic impression materials. And so even if we have a case of complete denture designing, we may use elastic impression materials. In general, the non-elastic impression materials which they are used for complete denture, they are either impression plaster, and you see that the plaster, it is non-elastic impression materials. Again, the impression compound to take a primary impression for the case, and zinc oxide eugenol paste. Again, it is non-elastic or rigid impression material used to take final impression for complete denture. These details of these materials, you are going to take it in the prosthetic subject in the next years, in the 4th years or 5th years, you are going to take details of the impression materials for complete denture. Now, the elastic impression materials, which they are used for what? For partial denture, removable partial denture, and fixed partial denture, crown and bridge, because of the presence of teeth, which they have undercuts. And when we put an impression material in the patient's mouth with his teeth, the material must be expanded. And this expansion, which make it easy to be removed from the undercut, and this material must return back to its shape after it is removed from the undercut. So it is not only a soft material. If a question came to you, say that the impression material used for crown bridge must be soft. It is not a complete correct answer. It must be elastic. What do we mean by elastic? It must be stretched, and when you remove the force of stretching, it must return completely to its original shape. It is complete elastic. It must return to its original shape. If it is not return, does not return to its original shape, it is not completely elastic, and it must not be used for taking perfect impression. So this is very important to be considered in your selection of a material which has be used for taking final impression for crown and bridge. In the partial denture or in the removable partial denture, it may not cause dangerous failures, but in crown and bridge, it is very delicate work. So you must have a very perfect impression material to be used for taking the final impression. The elastic impression materials may be divided into two types. Hydrocolloids, which they are a nature of materials made from colloidal materials. These colloids materials, they are mixed with water, or they are made from watery nature, or it may be mixed with water. This is, we call it the hydrocolloids. From their name, they are called hydro. Hydro, that means they are either has watery nature or they are mixed with water. This is the hydro. Colloid, it is a suspension or a suspended type of material. They are mixed with water and they are going to be dissolved or reacted with water, and then they finish their reaction to be set as an elastic material which they are going to be used for impression. This is the hydrocolloids. There are another type of impression, elastic impression materials. They are the polymers. دقائق ثواني وارجع لكم اكمل لكم الكلام مالتي في الطارئ صار عندنا. خليكم ابدا لا حد يغادر، ثواني وارجع لكم. في الطارئ صار، ارجع لكم ثواني. اوكي شباب نكمل. Elastomers or elastomeric impression materials, elastic impression materials, or they called rubber bases. They are polymers in nature. They are polymeric impression materials, and they came in two pastes or two consistencies or two types of materials when they are mixed together in cold way. We does not need any heat. When they are mixed by hand or by mixing tools, they are going to be reacted with each other and they are set into an elastic material which is going to be used for taking impression. Hydrocolloids, they came in two types. The most commonly used type is the alginate impression material. It is irreversible. That means when you are going to mix the alginate, it will set to a completely final material, which we cannot repeat its nature to take impression with it. It is used for only one time. It came in a powder nature. This powder is going to be used with water, mixed with water, and we can mix it, put it or load it in the tray and take the impression. It is going to be used for primary impression because what? Because it is not, its nature is not able to record the fine details or the accurate details of the surfaces. Its flow, it does not enough to go below the gingiva, or it's not going to be able to record the fine details. So it is mainly used for primary impression to produce a steady cast or steady casts. This impression material sometimes used in the crown and bridge to produce the opposite arch. It is not completely discarded from our fixed processes work. We can take the final impression by elastomeric impression materials, and we can take the impression for the opposite arch with alginate, and this is the commonly way to take impression for the final for the case of crown and bridge. So if a question came to you that can we use alginate material, impression material in crown and bridge construction, and this question always come in the examinations, you must say that yes, we can use alginate impression material for crown and bridge, but not for the working area. We can take alginate impression material for taking an impression for the opposite arch, right? The second hydrocolloid material, it is the reversible. It is the agar-agar, and this material, it need heat to become soft, and then we can take impression for the patient, and then there is a cooling system which make it cool and return to its elastic nature. It is very good impression material. It can give me an accurate details, but its technique to take impression require a special designed tray and extra equipments or complex equipments to cool the material and to heat the material, and this is difficult and not available for any dentist, so it is not commonly used, but it is considered as a perfect or very nice impression material to take fine details for the crown and bridge final impression material. Nowadays, they reduce the complexity of taking impression with agar-agar, and I may show you a film for the taking impression with agar-agar, which give me a very nice, accurate final impression material. The other types of elastic impression materials used for taking impression, final impression for crown and bridge case is the elastomeric or rubber basis impression materials. They came in 3 types: polysulfides, polymer, it is poly. All of them they called poly. Polysulfide, polysilicone or silicone, and polyether. All of them, they are polymers, and the chemical composition of each material is present in the dental material lectures, and you can go back to the dental material lectures to see the details of each material. The most commonly used material is the silicone. The polysulfide came in different viscosities or consistencies. There is the light body and heavy body, or sometimes there is a medium consistency, which is middle between the light soft material or syringe material or liquid or fluid-like consistency, and the heavy body, which is a putty material, which is going to be used in the tray, and there is a medium consistency, which is going to be used only alone with a special tray technique. The silicone impression material, which is commonly used impression material, it came in two types, either condensation type silicone or addition type silicone. It is differ due to the difference in the chemical composition or the chemical consistency of the material. The addition type silicone is the most commonly used type because it has a little dimensional changes, or it has a good dimensional stability of the material after setting of it. The polyether, again, it is another type of impression material of elastomeric impression type. Monophase or single viscosity impression material, as I said, we have three consistencies of elastomeric impression materials, either light body or fluid consistency, either heavy body, which is putty-like, or it has a very thick body consistency, and the middle or the medium consistency type. This single viscosity or single monophase impression materials, it has a higher apparent standing consistency. That means it is a consistency which we can easily manipulate, and in the same way it is a soft consistency to be go down to give me the accurate and subgingival recording of the material. It is called Theotropic Consistency. It is used with a special tray, and it can be injected directly in the special tray, and we can take one-step impression technique. Now, for polysulfide, or I'm going to go in details in the next lectures. I'm going to go in details about the impression materials. Polysulfide impression materials, they has nice dimensional stability and tear strength than what? Than hydrocolloids or alginate impression materials. So the hydrocolloid impression materials, the alginate, it has a disadvantage. This disadvantage, which can make it not used in the final impression of crown and bridge, which is the tear resistance or tear strength. What does it mean? That means it may be teared, or it may be damaged during removal from the patient mouth. This is, we call it tear strength or tear resistance. The polysulfide has very nice tear resistance, and it has good dimensional stability. That means it will not change when you take it from the patient mouth. It will not change. Again, the polysulfide impression material must be poured as soon as possible after taking the impression. We must not delay the pouring of the polysulfide impression materials. Why? There will be a possibility of production of what we call it byproducts, and this byproducts will lead to dimensional changes in the long time. So this will make the impression material to be changed in the long time. So it is advised to pour the impression immediately after you take the impression. It has a long setting time. The reaction of the polysulfide or the polymerization reaction of the material, it may take long time. So we must modify the catalyst or the accelerating material to adjust the setting time. The setting time can be adjusted according to the affecting factors. Please listen to me. The setting time must not be too short and it must not be too long. Too short setting time will not make you able to take successful impression. Why? Because we know we need to inject the soft part of the impression material in the area in the patient mouth, and then we must then go back and we load the tray with the heavy body, or we may load the rest of the impression material in the tray, and then we take the impression. So this is need enough setting time before it sets. If it is too short, we will not have the time to take the impression. If it is long setting time, it will make it difficult for the patient to withstand or bear the impression for a long time, and this will lead to a damage in the impression material because of its flow. It will flow in the patient mouth and it will not be a perfect impression material. So we must modify the setting time by what? By adjusting the amount of the catalyst or the accelerating material. We can increase or decrease the accelerator or accelerating catalyst material, which is the lead peroxide, which is going to give a color, brown color for the material, and this material may be slightly sticky and it will stick to your hand or your gloves, or it will stick to the skin of the patient, and these are some of the disadvantages of the material. The silicone impression material, the condensation type, it has poor weighting. So the weighting, it is a property of a soft material to be spread on a hard or on any other surface, and this weighting, it is very important property for impression material to be distributed on the tooth structure or on the teeth or prepared teeth. If it is poor weighting, it needs time to be flow. By this poor weighting, it needs time to be flow before setting of the material. If this weighting is poor, that means the material may be set before it is completely flown on the tooth structure, and this will give a possibility of defect in your impression. So again, when we want to pour the impression, we want the gypsum material or the stone material to be distributed easily on the material. If it is poor weighting, that means the stone will not be slide easily on this material. It will not it will not wet the impression material easily, and there will be a possibility of air bubbles in the cast, in the pouring of the material or impression material. Again, compared with the other impression materials, it has poor dimensional stability after setting because of the presence of shrinkage. This material will be shrink just like the polysulfide due to the presence of water, which is going or ethyl alcohol and water. Both of them, they are byproducts they are going to be produced after the or during the polymerization of the material. This will lead to a shrinkage of the material after setting, and it will lead to a change in the dimension of the material. We call it the poor dimensional stability. Both polysulfide and condensation silicone, they are condensation polymers. That means the reaction of the polymerization of these two materials, it is a condensation polymerization. We have two types of polymerization, either addition or condensation polymerization. Polysulfide and condensation silicone, they are polymerized in a condensation way of polymerization. This is the way of wetting. With hydrophobic material. The first picture, when the material is hydrophobic, has a hydrophobic property. That means when we put it on a surface, it will not spread easily. With hydrophilic material, the water tends to spread more uniformly. The water is a hydrophilic material, and when you put it on any surface, it will spread easily. And this, we call it the wetting property of the materials. If it is tend to be in a hydrophobic, it will have a high surface tension of the material, which make it difficult to be spread on the surface touch with it. The addition type of silicone, we call it the vinyl polysilicone material type 2. It is slightly stiffer than the polysulfide. It has great dimensional stability because of the type of or the way of reaction. Okay, our time is finished. My lecture, I will end my lecture to this end, and I will continue my lecture in the next time. In the next lecture, we reach to the addition silicone, because my time is finished, and I will see you in the next lecture. If there is any questions, I will end my lecture to this part, and I will discuss the Arabic part in the next lecture. Okay. Okay. If anyone has any question, I will. Anyone has any question? أكو حد عنده سؤال شباب؟ أكو حد عنده تعليق؟ منو عنده تعليق؟ أكو حد عنده تعليق؟ أكو حد عنده سؤال؟ الشات مالتكم ما في أسئلة. هو المادة يعني أكثر شيء ترى اليوم محاضرتي تقريبا وكأنها دينتال ماتيريال، فراح أكملها إن شاء الله. راح أشرح العربي مالتها، أبدي يعني إن شاء الله بالمحاضرة الجاية أبدي بالعربي إلى أن أوصل إلى السيليكون أديشن تايب، أكمل محاضرتي باللغة الإنجليزية. أوكي، أكو فد سؤال ممكن نجاوب عليه؟ عليكم السلام. يعني أكثر تقريبا راح ننهي المحاضرة مالتنا إن شاء الله، يعني ما عندنا بعد نكملها لأن المحاضرة كبيرة، وحتى بالمنهاج العام إحنا مالتنا المحاضرة على جزئين أو ثلاثة ممكن نسويها، بس جزئين تكفينا إن شاء الله. نتوقف لهذا الحد ونكمل إن شاء الله بالمحاضرة الجاية. إذا ما حد عنده سؤال إن شاء الله إذا نلتقيكم بالمحاضرة الجاية نكمل، أو بالمختبر يجوز نشرح بعض التفاصيل، أراويكم بعض الصور. إحنا محاضرتنا اليوم وكأنها ما فيها صور هواية، وراح أعتمد على الأفلام الفيديو اللي نعرضها وتراويكم تفاصيل كثيرة ونشرح بالعملي أكثر. حضروا نفسكم، راح أعيد لكم الحكاية مالتي بالوقت المختبر، يعني يوم الأحد الجاي. احتمال أعطيكم إعلان وراح أبلغ عبد الله أنه يبلغكم أنه أكو شعبة من الشعب راح تمتحن يوم الأحد حسب الوقت اللي باقي لنا من المختبر. احتمال أخلي ساعة لامتحان الطلبة مال الشعبة. احتمال شعبة أيوان راح تكون مرشحة للامتحان الشفهي بالمختبر. اقروا المحاضرات الستة، أول 6 محاضرات. تسمعوني شباب؟ الحاضر يبلغ الغايب، لا يجي بعدين واحد يقول ما بلغتونا. زين، محاضرات الستة يعني الأولى اللي هي 3 امتحنتوا بيهن و3 ما امتحنتوا بيهن، على أساس نمتحن بيهن راح تكون الأسئلة الشفهية من عندها. زين، طريقة الامتحان الشفهي قد أعرض لكم فد سلايد، أو أعرض لكم فد صورة، أو أعرض لكم فد شيء وأسألكم عليه. كونوا مستعدين للامتحان الشفهي، مو صعب، وما أريدكم دائما تصورون أنه الأمور صعبة. الأمور سهلة وإن شاء الله أنا وياكم نتعاون عليها. يلا، في مان الله، نلتقيكم بخير، مع السلامة.